Dive into one of the most personal and important conversations we can have, end-of-life care. This is a topic that really touches on our deepest values, things like dignity and choice. And, it also shines a light on the incredible people who care for us during those final moments. So, let's get into it.
This quote, it really just gets to the heart of it all, doesn't it? It's such a simple, powerful idea. It's a universal wish that cuts across every culture, every background, and honestly, it's the real reason we're even having this conversation today. This fundamental desire for peace is the human element right at the center of this whole discussion.
So, before we jump into all the legal details and the different procedures, I think it's really important that we pause right here and just understand this core goal. We got to start with the why, What is the fundamental purpose of end-of-life care in the first place? And that's a really powerful shift in perspective, right? This isn't about prolonging life no matter what, but about improving the quality of the time a person has left. And who is on the front line actually making this happen? It's the nurses. Through their deeply personal, one-on-one interactions, they are absolutely essential in guiding patients and their families, making sure suffering is minimized and dignity is always upheld.
Now, this universal wish for a peaceful end, it isn't just a philosophical idea. It has real-world consequences, and it's leading to some really interesting, evolving legal frameworks all over the world. So to understand this a little better, we're going to zoom in on one specific example, Canada's approach, which is known as Medical Assistance in Dying, or MAiD for short.
So, what exactly is MAiD? Well, the definition is very, very specific. First off, it's a process that has to be started by the patient. That patient has to be a competent adult with a terminal illness, and it involves a physician providing the means for that person to end their own life. See, the entire framework is built on these two huge pillars, patient autonomy and the desire to avoid suffering.
The path to legalizing MAiD in Canada definitely wasn't an overnight thing. It actually unfolded over several years. It all started with a landmark Supreme Court decision back in 2015. That really paved the way for Bill C-14 a year later, which officially made MAiD the law. But the evolution didn't stop there. In 2021, Bill C-7 expanded who is eligible, which was a pretty significant shift. What this timeline really shows us is this continuous and pretty rapid evolution in both the law and how society thinks about this issue.
And when you actually look at the eligibility criteria, what immediately jumps out is just how strict they are. If we take Quebec as an example, it's crystal clear this is not a simple process at all. A person has to be an adult, fully capable of making their own decisions, and facing a grave, incurable condition that causes absolutely unbearable suffering. This isn't some casual decision, it's a very carefully controlled system with multiple safeguards built right in.
So, we have the law and we have the doctors. But who's there for the intimate, day-to-day reality of this process? Well, that's where the nurses come in. They're the ones navigating these deeply personal moments with patients and their families, and believe me, their role is absolutely vital.
Just take a second and look at this list. A nurse's involvement is not passive at all. It is profoundly hands-on and it's comprehensive. They are assessors, educators, coordinators, and caregivers. From that very first conversation all the way to supporting grieving families after it's all over, they are the constant, empathetic presence through the entire journey.
But here's the thing. This central role also places nurses at a profound ethical crossroads. They find themselves caught between institutional rules, their professional duties, and their own personal values. And that creates a really significant internal, a conflict.
And this slide just illustrates the core tension perfectly. On one side, you've got these institutional leave-the-room policies, which are designed to legally protect the hospital. But on the other side, you have the nurse's core ethical duty of non-abandonment, that promise to be present and provide care until the very end. These two things are in direct opposition to each other.
And when a nurse is forced to act against their own ethical code, it can cause something called moral distress. And this isn't just, having a bad day at work. It's a deep psychological wound that leads to burnout. The tragic consequences is that for some nurses, this distress is so profound that it actually drives them to leave the profession entirely.
So all of this raises a really crucial question. How do we fix this? How do we better support the very people we task with providing this compassionate care? Well, it seems the answer involves two key things: building specific skills and creating much more supportive environments for them to work in.
To navigate this incredibly complex terrain, nurses need a really robust toolkit.
This means mastering things like symptom management, becoming incredible communicators, and leading with empathy. But the responsibility doesn't just stop with them. Healthcare organizations absolutely must step up with better training, clearer guidelines, and professional support that truly equips nurses to handle the immense ethical and emotional weight of this work.
And that leaves us with this final essential question. As our society continues to navigate choices around end-of-life care, we have to consider our collective responsibility. Because supporting our nurses isn't just about healthcare policy, it's about upholding the very compassion and dignity that we all hope for in our own final moments.